Hi everyone, my name is Dr. Michele Foster and I am a clinical psychologist here in Toronto and also the co-director of Toronto Psychology and Wellness Group, which is a multidisciplinary clinic here in Midtown Toronto, servicing the needs of adolescents through to adults with a variety of different mental health issues. We have primary clinical and research interests in the treatment and prevention of eating disorders, but we also work with individuals who are struggling with challenges pertaining to emotion regulation, so things like depression or anxiety and self-harm, and we use evidence-based treatments to support our clients, drawing from things like CBT and dialectical behavior therapy as well, both in individual and group formats. And I'm really glad to be here today and want to thank NEDIC for having me, but more importantly, for taking the time to really try and develop an online platform where individuals can reach out, communicate, and get a number of different strategies and tools for coping, because right now with everything that's going on, a lot of the coping strategies and resources that people are used to accessing might not be as applicable or available, and so NEDIC, thank you for standing up, for reaching out to people all over the country to really support the community as we work through this together. One of the things that I wanted to talk to you about today is a specific strategy that's rooted in mindfulness, but also linked to dialectical behavior therapy, that has to do with regulating our emotions in the moment when we feel like they are completely overwhelming. This is something that can be used by individuals who may be struggling with disordered eating, but it can also be used by anybody. And I don't know if you guys have ever noticed this, but it's certainly true for myself, and I notice it with a lot of my clients as well, that sometimes when we're feeling really heightened emotions, it has to do with the fact that we're not actually thinking about things that are in the present moment. So as an example, right now, it makes perfect sense that we would be anxious or worried about things related to COVID-19, right? However, if we start thinking about the future and we get wrapped up in all of these what if thoughts, so it could be things like, what if I get sick? What if my loved ones are unwell? What if life doesn't go back to normal the way it was? What if I can't go back to school? I'll spare you from throwing a bunch of different what ifs at you, because I'm sure a lot of us struggle with that already. But you can see those thoughts quickly layer on top of each other, and all of a sudden our anxiety gets amplified, right? And that's a perfect example of how future thinking can really amplify our emotions. The same thing can actually happen with thinking in the past, right? So I've talked to a lot of people right now who are struggling with things like sadness or regret or longing, right? Because when they think about the past, they miss the way that things were. A lot of people have said to me, I miss being able to access my usual supports. I can't go speak to a friend as easily. I can't go exercise in the way that I used to that was healthy and balanced for me. A lot of people too have said to me, I regret not being as engaged in my treatment programming before all of this, because now it's less accessible to me, right? So there are a number of different feelings that people can feel when they start thinking and kind of spiraling with thoughts in the past. And again, you can see how that can amplify things. Now, you can absolutely have feelings of sadness or anxiety linked to things in the present moment, right? But what happens is when we go to the past or the future, we're kind of doubling down on that a lot of the time, because those thoughts, they go really quickly, and we often end up, I call it like riding the train. So riding the train of our thoughts to that place, and then getting really disconnected from the present moment and what we can actually control and manage. So what do we do about that? You're like, why do you keep talking to me about this? I'm going to show you. So I've drawn here, I hope you can see it. It's a continuum of past, present, and future. And what I want you to do is, in the moment, when you notice that your emotions are really heightened, my recommendation is to actually visualize this, right? So you could draw it out for yourself. You could even take a picture of it and keep it on your phone. And when you notice your emotions are high, I want you to visualize it and pause and say to yourself, where am I, right? So asking yourself, where am I physically? And where am I cognitively or mentally? If you notice that those two things are misaligned, so physically I'm in this room, but cognitively I might be thinking about all of my worries about the situation and what's going to happen, right? Okay, so if there's a disconnect, we want to bring that back and we want to close the gap a little bit. How do we actually do that? We do that by, first and foremost, I like to recommend grounding strategies. So if you don't know what that is, it means actually trying to ground yourself in the present moment. One way of doing that is by focusing on things that are in your environment. So for example, I have this blue wall behind me. So it might be focusing on that. It might be naming several things that are blue in my environment. It could be things like really focusing on the sensation of my feet planted firmly on the floor. It could be focusing on my breathing and noticing the sensation as my my lungs expand and contract as I breathe, right? So just a bunch of different solid strategies to help you come back to the present moment. Once you're there, you can say to yourself, okay, in this moment, what am I worried about, right? If it's something in the present moment, the benefit of that is that there are actually different strategies you can use to control that, right? Often. So for example, if I'm worried in the present moment about something I saw in the news, I can easily turn the news off. I can check the facts. I can talk to a friend, right? If I'm worried, for example, about a meal that I'm having in the present moment with my family or whoever it might be, again, I can use different strategies to manage that anxiety. So I can go for a walk. I can speak to a friend. I can check the facts again about the worries and the thoughts that I'm having about that meal. There are different strategies that people might have used in treatment to be able to manage that in the moment. But for instance, worrying about a meal that I might have in the future, which may or may not happen, and how I'm going to cope with that, it doesn't make a lot of sense, right? And it's not necessarily something that we need to worry about right now. So noticing that the thoughts are drifting and bringing them back to the things that we can control in the present moment can be incredibly helpful. I just want to note also that sometimes there are things that we can't control in the present moment, right? So there might be certain things that we actually do have to accept. Like we cannot control that right now school is off, or there are certain things that we're not able to do. We have to move into acceptance, right? But we can also use different strategies around trying to make the best of the present moment. So I just wanted to honor that by mentioning it as well. Again, though, the point is generally that worrying about things in the future or thinking too much about things in the past can amplify our emotions. And so coming back to the present moment where we do have a little bit more control tends to be really helpful for people. So I hope this information is helpful to you. And NEDIC, again, thank you so much for taking the time to have me here today and for all you're doing for the community and supporting us as we work through this together, and wishing everybody health and safety. And hopefully we will get through this sooner rather than later. Be well, everybody, and thank you so much.